which common herbs might help your libido, and we explore positions that maximize pleasure for women. Plus, we look at how to keep hot flashes from ruining the mood. That's next on Sex Talk.
Welcome to Sex Talk, where we answer the questions you've always wanted to ask about sex and relationships. I'm Dr. Labiaplasty, Associate Professor in the Department of Health and Human Performance at Nova Southeastern University. And joining me today is Sex Talk correspondent Derek Latta.
Hello, Dr. Leah. Good to see you once again.
Absolutely.
Let me compliment you on this color. You always look good no matter what you wear, but this color, really, your color.
Thank you. We almost kind of match, which was not on purpose. We see the little gray and the light blue,
yeah.
you know,
almost. Looks better on you, the beauty and the beast, so we'll go with that. Oh, by the way, we got some great questions today.
Okay.
Women, stay until the last question because you're going to really like this question. It's going to help you, okay? And men too, okay? But here we go. Question number one, here it is. What are the benefits of turmeric and ginger for sexual health?
Both of these can enhance flavors and possibly your sexual health. These are two interesting herbs that work particularly well together. One of the reasons is that curcumin, which is a turmeric, is not absorbed well, so consuming it with other things like coconut oil or avocado oil helps. Consuming it with ginger might enhance its effect and help with digesting it. While there are several benefits, be careful not to overdo it. Too much of anything can always have adverse effects.
You mentioned benefits, so what are some of those benefits?
Both of these could help with blood flow and circulation, improving male libido. Curcumin, a compound in turmeric, and gingerol, the active ingredient in ginger, enhance nitric oxide production. Nitric oxide is what helps muscles relax and increases blood flow to the genital area. It can also help libido by boosting testosterone. There was one study that found that ginger helps with this. Plus, both turmeric and ginger have anti-inflammatory properties that can help balance hormones.
Can it help with ED and male fertility, for example?
Well, it might help with ED. The antioxidants in these herbs may combat oxidative stress, which can contribute to ED. And then there's also the possibility that it could help with fertility. Male fertility depends on the production of healthy sperm cells. Hormonal imbalances, genetic factors, environmental toxins, and lifestyle habits can compromise this. One study found that ginger may support male fertility by improving sperm quality. In general, the antioxidants and the anti-inflammatory effects have the potential to help with a lot of different health concerns, whether it's sexual or not.
Is it taken orally in capsules or in food?
You can do both. You can put it on your food, and like the anti-inflammatory effects are great. A lot of the times you'll see it in Indian food, or if that's just not your taste preference, you can take a capsule.
Our next question from another viewer. Should I get the HPV vaccine if I'm 30?
For adults between the ages of 27 and 45, the HPV vaccine can still offer benefits, but it may be less effective. This is because older adults are more likely to have been exposed to some strands of HPV already. However, the vaccine can still protect against strands you haven't encountered and prevent future HPV-related health issues.
And what does the vaccine protect against?
HPV is responsible for nearly 70% of throat cancers in the United States, which can include the tonsils, soft palate, and the back of the tongue. It can also include genital cancers and warts. The HPV vaccine protects against several high-risk strands of HPV, like the most common strands associated with these cancers and the strands most commonly linked to genital warts.
So what are the recommendations for the vaccine?
Well, the CDC recommends that children between the ages of 11 and 12 get vaccinated, and that everyone through the age of 26 who hasn't been fully vaccinated. So if you're older, talk to your doctor about whether or not it's a good choice for you. For a little more insight on why getting vaccinated early is recommended, listen to what this doctor has to say.
We want to catch somebody, that is, be sure that they're protected before they initiate any sexual activity. That's a very hard thing to predict. So the younger, so to speak, the better, so we know they're protected. The second thing is boys and girls between 9 and 15 really have great immune responses to this. They still respond between 15 and 26. After age 26, they're sort of immunologically old, at least as far as this vaccine, and they don't respond very well. So we want to catch them early in age, before any sexual activity.
So it's all about prevention. HPV is fairly common, right? You said a lot of the older adults have been exposed to it, more than likely.
Yeah, it really is. It's estimated that most sexually active men and women will be infected in their lifetime, and that as many as half will have a high-risk infection that could potentially lead to cancer. So the vaccine is just one excellent method of prevention.
All right, thank you. Ready for your next question?
Oh, yeah.
Here we go. A viewer says, I'm self-conscious about my cellulite in the bedroom. Is there anything I can do to make it better?
Well, you're not alone. Cellulite is a common condition that affects many people, especially women. While it's not harmful, it can affect your confidence. It looks like uneven, lumpy skin, primarily on the hips, thighs, and bottom. While it occurs when the skin overlaying certain areas of fat is pulled down toward the deeper tissues by connective tissue bands, creating an uneven surface.
And why would this be more common with the women, for example?
Well, women are more likely to develop cellulite than men due to differences in fat, muscle, and connective tissue distribution. It's estimated that 90% of women experience cellulite at some point in their lifetime.
And what causes this?
Cellulite is caused by a buildup of fat beneath the skin, and there are several factors that lead to this, starting with genes. Hormone changes can also contribute to cellulite, particularly during puberty, pregnancy, and menopause. Other factors include aging, diet, and lifestyle. Weight gain and even toxin buildup can have an effect.
You know, I've seen some young girls with skinny, thin, with cellulite. So this is the product of genes or hormones with the cellulite?
Yeah, absolutely. So it's interesting. There's a term, it's not the greatest one, we call it skinny fat, but it's basically for people that don't lift weights but are very thin but still kind of have a very loose frame.
Okay.
So you can be skinny and still have a high body fat percentage, and a high body fat percentage links to higher likelihood of cellulite.
Okay, so let's say they don't have a high fat percentage, but it is due to genes and hormones. What can they do to avoid or eliminate the cellulite?
Well, I know that there are creams and products that work. So topical treatments can help reduce the appearance of cellulite, but their effects are temporary and typically require daily application. These creams usually work by tightening the skin and adding moisture, making the skin appear smoother. Common ingredients include caffeine, which increases blood flow and acts like a diuretic, and retinol, which thickens the outer layer of the skin. However, these treatments do not remove the underlying fat cells, so for better results, someone might try using a cream along with dietary changes.
So what about procedures for this?
There are actually procedures. There are several options that may yield a longer lasting result, typically offered by a doctor or dermatologist. For example, cool sculpting is a non-invasive procedure which claims to remove cellulite by freezing fat beneath the skin, causing them to rupture and be absorbed by the body. Multiple treatments are usually needed, and these treatments can take 3 to 4 months for anybody to notice a difference. There's also ultrasound that uses sound waves to target and eliminate fat in specific areas like the abdomen and thighs. This also takes a few months to see the results. Another procedure called Selfina may have more rapid results. It uses a needle to break up tough bands under the skin to reduce the appearance of cellulite. Other options include acoustic wave therapy, laser therapy, and radiofrequency treatments. And there's also something called vacuum-assisted precise tissue release. So lots of options, and the results can last for years. The ones that last for years, though, are pretty expensive.
Which is the one that maybe it's an old method, but they go
Oh,
under
liposuction.
Liposuction.
So liposuction actually doesn't. Liposuction reduces the deeper layer of tissue, so you'll appear smaller, but the cellulite is a more superficial layer of tissue, so that one doesn't help. But if you are wondering why all the celebs can have everything that looks great with no cellulite, it's permanent procedures that are breaking those tissue bands.
Oh, nice. Okay.
Yeah, they're not cheap.
I was going to say it's probably not,
Yeah, not
kind
cheap.
of expensive.
Not cheap, and much more painful than the other methods.
Oh, okay. Well, let's go to a cheaper answer to this question. This question from our viewer: can PRP really help with orgasms? First, can you walk us through what PRP is?
Okay, so PRP stands for platelet-rich plasma. They are injections that use platelets from the patient's own blood to stimulate tissue growth, and in turn help improve sexual organs. Some patients may have improved arousal, stimulation, and sensations, making orgasms easier and more frequent.
Okay, I'm a little lost. So what is it targeting? What are those cells targeting? I mean, how does it work?
Well, it takes as little as 30 minutes since it uses the patient's own blood. The first step is to draw that blood, which is spun in a centrifuge to get the platelet-rich plasma separated from the rest of the blood. And then it is injected right into the clitoris and the G-spot area, which is really just part of the clitoris, which sounds painful, but don't worry. It should be mostly pain-free, as they will typically use numbing cream or use a local anesthetic.
And are the results like immediate?
Well, some women report instant results, but for most people, it will take a few weeks, with optimal results occurring at week 12. And the results can actually last as long as 2 years.
And PRP is not just used for that, it's used also for like knee injuries, hip, all kinds of shoulder.
Yeah, and it's even used for superficial reasons, right? So they can take PRP and put it in your skin and stimulate collagen for your skin.
Almost like a rejuvenation type of therapy?
Yeah.
In a sense?
Yeah.
Nice. Good to know. Our next question, Dr. Leah. I'm a 75-year-old black male, and after some heart issues, including severe angina, my doctor took me off Viagra because of the interaction with the nitrates used to treat angina. But my ED is back. I am wondering about another ED medication called alprostadil. What are the risks and what are other solutions? Tell us first, what is alprostadil?
Well, it's a medicine that keeps blood vessels open by relaxing the walls of the blood vessels. It increases blood flow and promotes smooth muscle relaxation, which can help achieve and maintain an erection. It has two forms. It could either be an injection or a suppository.
And what are the differences in these two?
There are multiple brands that offer injections, and they are about 80% effective. When it comes to risks, they include possible injury and medication interactions. It's less safe than oral medications for some people. As for the suppository, there is really only one brand called Muse. It's about 30 to 40% effective. So it's less effective than the injectable form and may cause some discomfort. All considerations are important, so just definitely go over it with your doctor.
So this gentleman said that he was taken off Viagra. Why would that be?
Well, PDE5 inhibitors such as Viagra are commonly used to treat ED. However, their interaction with nitrates can lead to dangerously low blood pressure. Even the American Heart Association warns that nitrates and PDE5 inhibitors should not be taken together.
Okay, I mean, what exactly are nitrates? You hear about nitrates in foods and wine and stuff. I mean, what and why are they bad?
Well, nitrates themselves are not inherently harmful. When consumed from natural sources like vegetables, they can have significant health benefits. It really comes down to how the body processes these nitrates. When your body breaks down nitrates from vegetables, it produces nitric oxide, which increases blood flow, reduces blood pressure, and promotes overall cardiovascular health. But when nitrates are added to processed foods, they do not come with the protective antioxidants found in vegetables and can lead to the breakdown into harmful nitrosamines.
Sir, if you're watching this, I hope we answered your question. You ready for your next one, by the way?
Yep.
Okay. If I start taking ED medications, do I have to take them for the rest of my life?
People always ask this. In most cases, if you start using ED medications now, you will probably need to continue them for the foreseeable future. Age-related erectile dysfunction is typically irreversible because it stems from natural declines in the body functions. And over time, this issue may get worse. The progression of ED varies. For some, the decline is slow, allowing medications to remain effective for many years. However, there may come a time when additional therapies may become necessary as the condition advances.
So what if you notice that these treatments are losing their effectiveness?
Well, penile injections are an option. For many men, they can be a discreet and effective way to achieve a firm erection. These injections can be self-administered at home or after proper training. And in cases of severe ED that do not respond to medications or injections, a penile implant may help. This is a surgical procedure that involves placing an implant that allows for controlled, on-demand erections. Most patients report excellent outcomes and a return to a satisfying sex life.
Can anything slow the progression?
Maintaining a healthy lifestyle, as I always say, can significantly impact your sexual health. This includes minimizing alcohol consumption, quitting smoking, losing weight, and engaging in regular exercise. And then improving overall circulation through a healthy diet and regular physical activity can also help maintain erectile function.
Those are key for just about anything.
Everything. Life, health, happiness, sex drive, everything.
Everything. Beautiful.
Yeah.
Okay. Our next question, Dr. Leah. I am dealing with hot flashes and wonder if it's affecting my libido. What can I do?
Dealing with hot flashes can be challenging, especially when they start to affect your sex life. Women who experience abrupt menopause due to surgical removal of their ovaries often suffer from severe hot flashes that start immediately after surgery and typically last longer than those experienced during natural menopause. These hot flashes frequently occur during sleep, causing intense perspiration known as the night sweats. And there are several studies that link hot flashes to negative impacts on sexual activity. For example, it could simply be uncomfortable. The sensation of heat brought on by hot flashes can be so intense and unpleasant that the idea of intimacy or being sexual may be inconceivable. Feeling red and hot and sweaty can make you feel less attractive and less inclined to engage in sexual activity.
And what are some other effects?
Although available treatments may not eliminate all hot flashes, they can offer significant symptom relief, improving quality of life and interest in sex. Start with simple changes like sleeping in the nude, keeping a fan nearby, and avoiding triggers like spicy foods, caffeine, and alcohol can help manage hot flashes. Hormone therapy may help. This includes estrogen plus progesterone or estrogen alone for women without a uterus. Hormone therapy is effective but comes with risks, so it should be used at the lowest effective dose for the shortest duration necessary. And certain antidepressants have been approved for treating hot flashes. Other medications may also help.
So let's say besides these medications, are there any natural remedies?
Possibly. Herbal supplements such as soy products may provide some relief, but keep in mind their effectiveness varies and they may not be suitable for everyone. And sometimes we get questions about acupuncture, which may even help with hot flashes. Listen to what one patient has to say about her experience.
It starts at your toes and feels like your blood is getting hotter.
Polly Gilgenbach gets hot flashes.
You break into a sweat, you turn red. People wonder what's wrong with you.
Up to a dozen hot flashes every day.
You feel like you can't concentrate because you're hot and sweaty.
When the heat subsides, chills set in.
I live with this, the blankie. Sometimes I'm hot, sometimes I'm cold, and then I have to switch back and forth.
Rather than take medication, Polly opted to try acupuncture.
What it involves is placing very small, sterile needles along the body on specific points. Everything feeling okay?
Mayo Clinic acupuncturist Molly Mallory says the traditional Chinese philosophy behind the practice is to use the needles to bring balance to energy that flows through the body.
And the energy that flows through your body we call qi.
If this energy gets out of balance, you can develop symptoms. In Polly's case, hot flashes. Here's a more scientific explanation of how acupuncture may work. Needles in the skin stimulate pathways that travel through peripheral nerves to the spinal cord and brain. This causes your body's natural painkillers called endorphins to rise and other chemicals to change, unblocking trapped energy and restoring its flow.
So the acupuncture and the needles are allowing your body to get back into balance and bring about a state of homeostasis,
which is a state of wellness. This is Polly's 6th treatment. She says the needles do not hurt, she can barely feel them, and the sessions are relaxing. Plus, they effectively treat her hot flashes.
For the most part, I'm down to 2 or 3 a day instead of 10 to 12.
Fewer hot flashes, which are much less severe, make for much better days at the office and in life.
You know, I like the way they describe the science, Dr. Leah, but how it really helps with the flow of endorphins. Imagine there are many ways to do this in our bodies.
Yeah, exercise is well known for its mood-boosting effects and its role in decreasing symptoms of depression and anxiety. Laugh more, right? This saying is true. Laughter is the best medicine. Listen to music, happy music, dance, meditate, and of course, have sex.
I love that answer. Let's take another question. It is sex talk after all.
Yeah, absolutely.
Next question. Is it ever too late to get labiaplasty, and are there any risks?
For those who may not know, labiaplasty, which is also known as vaginal rejuvenation, is a plastic surgery procedure that modifies the inner lips or the outer lips and is mostly done for cosmetic reasons. Definitely talk to your doctor and see if you're a good candidate. As with any surgery, there are some risks, so most doctors would say that you should be in good health before undergoing any labiaplasty.
So why would women opt for this procedure?
Well, sometimes the inner labia are longer than the outer labia, and sometimes it's the other way around. No two vulvas and labia are identical, much like other parts of our bodies. Some people opt for labiaplasty if they feel that their labia are too long, while doctors or others do it for comfort and medical reasons. If the labia get tucked into the vagina during sex, it can result in painful tears. Similarly, wearing underwear, bathing suits, walking, running, biking, or even sitting can cause irritation or chafing, in which case labiaplasty may be necessary. Childbirth and aging can also lead to labia elongation, making the procedure necessary later on in life.
You mentioned risks. What are the risks in this procedure?
It's possible that sensitivity may decrease. Other risks may include chronic dryness, numbness, and scarring that could result in painful vaginal sex. With the surgery, there could be the risk of bleeding, hematoma, and infection. The over-resecting of the labia can also prevent them from protecting the vaginal opening, increasing the risk of infections.
Are there any alternatives to this surgery?
There are other procedures and things to try that have their own benefits. If there's a worry about appearance, some reassurance might help. Viewing images of diverse vulvas can help normalize your perception because there really are so many different shapes and sizes. You may want to make sure your partner is supportive about your body and not shaming it. There's also a thing called an O-shot that basically injects blood into the clitoris, and that's also supposed to help with arousal.
An injection into the clitoris. Okay.
Makes it swell up.
Okay. More sensitive, I guess?
It can.
Okay.
Yeah.
Our next question, Dr. Leah. Does L-arginine supplementation improve your sex life? First of all, what is it?
L-arginine is an amino acid that the body converts into nitric oxide, a chemical that helps blood vessels relax and widen, promoting improved blood flow. This process is essential for a variety of bodily functions, including the release of growth hormone, insulin, and other substances. Because of this, it's been studied for various health conditions, including sexual dysfunction.
And what are some of the potential benefits?
Well, L-arginine's most notable benefit for sexual health is its potential to improve erectile dysfunction. Studies have shown that taking 2.5 to 5 grams of L-arginine daily can enhance sexual function in men with ED. This improvement is attributed to the increased production of nitric oxide, which also helps improve blood flow to the penis. Interestingly, combining L-arginine with medications like sildenafil may be better than L-arginine or the medication alone.
Okay. And what are some of the other benefits that you know of?
L-arginine can also benefit individuals with high blood pressure, a condition that can negatively impact sexual health by improving blood flow and reducing blood pressure. L-arginine supplementation can enhance overall cardiovascular health, indirectly supporting better sexual function. Another condition it might help with is peripheral arterial disease, which causes narrowed blood vessels and poor blood flow to the limbs. Taking L-arginine orally or intravenously for up to 8 weeks has been shown to increase blood flow with people with peripheral arterial disease, although the long-term benefits on the walking speed and distance require more research.
You know, is it safe to combine with other medications?
Always check with your doctor because it can interact with several medications. It can lower blood pressure. So when taken with blood pressure medications, it might cause blood pressure to drop too low. And while taking it with something like sildenafil, both of those can lower blood pressure and could lead to an excessively low blood pressure. Medications for high blood pressure, like ACE inhibitors, can also have interactions. People will need to be careful with anticoagulants and antiplatelet drugs too, because L-arginine can slow blood clotting. Combined with other blood thinning medications, it may increase the risk of bruising and bleeding.
And Dr. Leah, this is the last question of the day. This is the one I said, everybody hang tight and watch this question and get your pillows ready. Are there certain positions that feel better for women?
There are several positions that may feel better for some women because the areas they stimulate. For example, missionary with a pillow may feel good. Simply adding a pillow can allow for deeper penetration and increased clitoral stimulation, making it feel better for your partner. To do this, the woman would lie down on her back and a pillow would be placed under her hips, creating a different angle. Another position that provided more friction against the clitoris is the cowgirl position. This way, the woman can choose the pace and the depth. For this, the woman would sit on top of the penetrating partner that is flat on their back.
Okay. And what are some of the others? that you know of?
Well, there is something called the Lotus. While it offers deep penetration, it also promotes deep connection through eye contact. For both partners, they have to face each other, and the penetrating partner is cross-legged. Here, the woman can also slow the control in the rhythm and the depth. Doggy style is another position where the angle may feel good to some women, and the same with spooning. Again, in this position, a woman has little control, allowing her to adjust her pleasure.
I like that. I like that Lotus position. You have to be flexible. I mean, cross-legged, sitting up
Go
straight.
there. Well, and so it's even more exciting than the pillow. They actually have, well, they've got the cheese wedge thing. That's what I call it. It's not like a real thing, but it's an angle. And then I recently just saw that they have a angular pillow that vibrates.
Oh,
So it can give you the right position and some extra motion. And
that's nice.
yeah, I don't know.
Serves you a drink as well?
Exactly. All right. Well, Derek, this was another great show. I loved answering these questions. We're out of time, but we will see you next time on our Sex Talk program when we answer the questions you've always wanted to ask.